Part 1, the billion-dollar crime scene. Moving right into Part 2, fraud versus abuse. We really need to understand the spectrum here. So the whole problem spectrum kind of begins with basic inefficiencies. Think of a doctor who orders a bunch of excessive diagnostic tests just to be safe. Now, this absolutely results in wasteful spending, but it completely lacks malicious intent. It's definitely a drain on resources, but we're talking about poor management here, not outright theft. But when providers start actively bending those rules, that's when we cross the line into Medicare abuse. A classic example of this is something called upcoding. That's assigning an inaccurate billing code to a procedure just to squeeze out a higher reimbursement rate from the government, like billing a routine 10-minute follow-up as a highly complex new patient visit. It's improper, it excessively charges the system, and it opens the door to some pretty severe civil liability. Then we get to the far darkest end of the spectrum, pure Medicare fraud. And the key word here is intentional. This requires intentional deception. We are talking about knowingly billing the government for services a patient never even received, paying kickbacks for referrals, or billing for appointments that patients literally didn't even show up for. This isn't a mistake, it's a deliberate crime, and it ends in present time. All right, on to Part 3, the scammer's playbook and how they target seniors. These sophisticated fraudsters are incredibly aggressive. Right now, they're calling, they're emailing, they're even knocking on doors, claiming Medicare is issuing some sort of new plastic or chip-enabled card. It's totally fake, all designed to get you to confirm your Medicare number. They'll try to lure you in with offers for free knee braces, genetic cancer screenings, or these bogus telehealth wellness calls. And once they have your digits, boom, they use them to generate massive, fraudulent phantom bills entirely behind the scenes. So here is your golden rule for navigating all these unsolicited offers. If a stranger is offering you something free out of the blue, they're not practicing healthcare. They're practicing theft, plain and simple. Medicare will literally never call you asking for personal information or banking details. If your actual doctor didn't order it, it's just a sales pitch. Walk away.